You would not believe how many patients have claustrophobia when it comes to getting an MRI. In this case, you can see that there's like a cage around their face. Now, this is likely some sort of thermoplastic mask that's used to keep the head steady. Now, a lot of times we try to use some sort of head fixation maneuver to try to keep your head still while we get a brain MRI. But as you can imagine, keeping your head in that position for such a long period of time can cause some anxiety for people. Some patients get claustrophobia and anxiety so badly that they need to be sedated for this type of procedure. We can give them some sort of anxiolytic medication to help with it, but in some rare circumstances, they might need to be intubated and put to sleep completely for this MRI. There were several times when I was a resident that the patient would just not be able to tolerate the MRI. They would be sent down, they would try to get it, they would attempt it several times, but when they have to sit there for hours on end, they just can't do it. And you pair it with the really loud noise of the machine, it just becomes a recipe for disaster. And this gets really tough when we need an MRI of the entire neural axis, which would include the brain, the cervical spine, thoracic spine, lumbar spine, and sometimes if we need it with contrast, that could take even longer, like 2 to 3 hours.